Well, hello, it's Bruce Williams again, and today I want to present the third lecture in my series on the selected gross pathology of the integumentary system. This is the second lecture in the part on viral diseases. The first lecture covered viral diseases whose primary lesion is necrosis or vesiculation. In this second lecture, we'll discuss a number of viruses whose primary lesion in the skin is cellular proliferation. But before we get into that, I want to thank, as always, my friends and colleagues who have provided me images over the years, which allow me to make these lectures available. One virus that is well known for causing large proliferative growths across animal species, both within the skin and also within the mucosal epithelium of the GI and urinary tracts, are the papilloma viruses. Like herpes viruses, most animal species have numerous papilloma viruses that we're only just starting to figure out. Papillomavirus research is a rapidly growing area of research because of the papillomavirus's notability for being able to ultimately induce malignant neoplasms such as squamous cell carcinomas. Let's start with cattle, in which papillomaviruses are divided into two broad subgroups. Those which are able to form fibropapillomas, large fist-sized growths, which involve both proliferating epithelium and underlying proliferating fibroblast, such as we see here on a cut section. You can see the thickening and the deep repeg formation of the epithelium, but look at this thick fibrovascular core. Both of these are proliferating at the same time, and this would be characterized as a fibropapilloma rather than a true papilloma, which is a smaller mass composed only of the epithelium. In cattle, papillomas viruses 1 and 2 are known for causing fibropapillomas to grow, whereas fibropapilloma types 3, 4, and 6 have a much smaller genome and are unique in that they only cause the proliferation of the epithelium. The papillomaviruses are also somewhat characterized in terms of where they appear, with bovine papillomavirus 1 affecting the paragenital areas, including the penis, the teats, and the udders. Papillomavirus 2 affecting the skin and rarely the alimentary canal and urinary bladder. Papillomavirus type 3 affecting the skin. Papillomavirus type 4 primarily infecting the upper alimentary tract and occasionally causing malignant transformation and squamous cell carcinoma, especially in the presence of compounds from bracken fern. And bovine papillomavirus 6, once again, affects the teats and the udders. Papillomas and fibropapillomas are able to do a number of things over time. Many may regress spontaneously, and some, as we said before, will express certain oncogenes later in their progress, including E5, E6, and E7, which release cells from the cell cycle by interfering with some suppressor genes, such as P53 and the retinoblastoma gene, and allow these cells to proliferate unchecked and form a malignant neoplasm. Infection is usually the result of inoculation, traumatic inoculation, and the virus will infect the cells of the basal epithelium. Early transcription of mRNA results in proliferation of the basal epithelium, and then later transcription results in the formation of additional virus particles. In a moment, we're going to talk a little bit more about bovine papillomavirus 1 and 2, which is able to jump species. And we'll get to that in just a minute. Another ruminant that commonly develops fibropapillomas are deer. These are usually seen in younger animals and often seen in male, and are thought to be the result of fighting. As we said before, papillomaviruses generally need to be traumatically inoculated. Here's an animal with multiple fibropapillomas, and the occasional fibropapilloma poses no problem for a deer, but usually what happens is animals that have large numbers, especially those around the face, especially the eyes or the mouth, will interfere with eating, and the animals will lose condition, have to be put down. Currently, deer have 6 different papillomaviruses, and probably much more, as is generally the case. Humans have over 100 at the moment, and more are being discovered on a fairly regular basis. Here's a pretty characteristic presentation of papillomavirus infection in horses and a number of other species. These small, occasionally coalescing cauliflower-like growths are common in horses and cattle and dogs affected with, and probably many other species, affected with papillomavirus. These are small, and they are composed primarily of epithelium. Papillomaviruses, for the most part, and we'll talk about one major exception, are very species specific. Another place that you can often find papillomas are in the ears of horses, the so-called oral, A-U-R-A-L, papillomas. Horses can also get oral, O-R-A-L, papillomas as well. But these are very characteristic, and they've been associated with a number of papillomaviruses, including equine papillomavirus 3, 4, 5, and 6. And unlike the ones that we saw in the previous slide, which tend to regress, these oral papillomas don't. They're probably spread from animal to animal by biting flies who penetrate the skin and liberate the papillomavirus, which they picked up mechanically into the basal layers of the epidermis. Another place that papillomas are commonly seen in horses are on the genitals, both on the penis and on the vulva of mares. There's been a lot of research recently demonstrating evidence that Equus caballus papillomavirus 2, we'll just say equine papillomavirus 2, promotes the development of these squamous cell carcinomas. These papillomas, which ultimately may end up as squamous cell carcinoma. So that's equine papillomavirus 2 associated with papillomas and ultimately squamous cell carcinomas of the paragenital areas in horses. Another papillomavirus-induced lesion that I have made reference to previously in this lecture is a viral growth known as a sarcoid. Now, sarcoids are actually non-productive infections which cause mass lesions, and the papillomavirus that has been isolated from sarcoids is a bovine papillomavirus. Papillomavirus types 1 and 2 give rise to sarcoids in horses. They're often seen on the head or the distal extremities of horses in areas where they may have rubbed against fence posts or somehow traumatized the skin in an area that was previously contaminated by bovine papilloma type 1 and 2. This is considered by many the most common skin tumor of horses, and probably, in addition to rubbing, may be transmitted by various fomites, such as insects. Research into the growth of these tumors and the contribution of bovine papillomavirus type 1 has shown that most sarcoids express major transforming protein E5. And E5 does a couple of things that enables the formation of a tumor. One, it binds to and activates the receptor of platelet-derived growth factor. And so that's an intracellular growth stimulatory signal to cause proliferation of the spindle cells which form these tumors. Additionally, the same protein downregulates MHC1 expression, so helps these tumors to evade the immunosurveillance mechanisms of the body. Now, there are a number of types which have been described. To me, they're usually all some variant of spindle cell neoplasms with a proliferating epithelium on top. And the classic ones, which we don't see too much anymore, you can see the spindle cells are oriented perpendicularly to the epithelium. Some people call it picket fence arrangement. A lot of these are ulcerated, so you really can't see that as well. The described forms are occult ones, or are very flat and just look like thickened skin. Then you have the very typical verrucous or wart-like ones. You have the fibroblastic ones, which can get very big and are sort of like exuberant granulation tissue. And then you have the mixed type. There's always a mixed type where you can't classify one, so you throw in a fourth category of the mixed type. One thing that we have gone to in our surgical practice, and we get a number of these. One of the issues is that it is very, very difficult to tell these histologically from benign nerve sheath tumors, which also you'll see in the skin. And there are no good immunos. They both can label positive for bovine papillomavirus type 1 and 2. So we tend to sign these out as spindle cell tumors of the equine skin. We mentioned that they could be either sarcoid or a peripheral nerve sheath tumor. But the treatment at the practitioner's end is pretty much going to be the same thing. And we've seen a number of these recur. They can be a little more aggressive looking in the future, but we have not seen any become overtly aggressive and malignant. So we've looked at the ruminant papillomaviruses, we've looked at the horse papillomaviruses, and the crossover, which is the sarcoid. Let's move on to another species that gets a number of papillomaviruses, and that is the dog. This is a great picture by Dr. Fabrizio Grandi. And one of the more common submissions to our surgical pathology are viral papillomas. A number of papillomaviruses in dogs have the ability to cause proliferative growths within the skin. The mechanism is very much the same. Infection of the basal epithelium, and then early transcription results in a proliferation of epithelial cells. Now, especially in the dog, there are two types of papillomas. One is non-viral. Usually it has to do with just repeated friction and proliferation of the epidermis as a result of a protective mechanism. The viral papillomas, they tend to have broad fronds. They may be larger. They're not in friction areas. And one of the things that you will see is you are going to see coilocytes, or swollen cells with a silver, somewhat fibrillar cytoplasm. They're large, and the nuclei are quite large, and occasionally, very rarely, you will see an internuclear viral inclusion, a small red inclusion. Usually this is in the stratum spinosum or the stratum granulosum. And if you see these coilocytes, they are very evident, and they are evidence that we're dealing with a canine papillomavirus infection. You can also see these cauliflower-like growths within the oral cavity as well. They're seen, the ones in the oral cavity generally seen in young dogs. All of these tend to spontaneously regress. This particular animal, in this case from Dr. Grandi, is an older animal that has been on high doses of corticosteroids. So probably got a good dose of these. Now, sometimes they are proliferative, they are exophytic, or sometimes they actually will invaginate down into the dermis and take this type of appearance with a dip into the subcutaneous tissue of the dermis, and then the fronds which proliferate into the center of this pore. There are quite a few number of papillomaviruses in dogs at this point. These have been associated with a number of them. Another lesion that may be seen in dogs, even those dogs who are immunosuppressed, seems to give them a bit of a oomph for developing papillomavirus lesions. And another great picture by Dr. Grandi from Vet School Sao Paulo is these pigmented cutaneous viral plaques. This is a sort of disordered epidermal growth which has been associated with a number of canine papillomavirus, numbers 3, 4, and 5, with canine papillomavirus 4 detected in almost half of these. They're most often seen in a couple of breeds of darkly pigmented dogs to start with miniature schnauzers and pugs being the two most common. They tend to have a very heavy granular cell layer, which may contribute to the color of these pigmented plaques. They're commonly seen on the underside of the animals, including the neck, the trunk, and the abdomen, but you can also see them in the extremities as well. There is potential for them also to transform to a squamous cell carcinoma. So canine pigmented viral plaques. And just to wind up the papillomaviruses, just an interesting picture from Dr. Ed Dick. This is cutaneous papillomavirus infection in a baboon. As we said before, humans have over 100 and growing, and chances are that most mammalian species have them, and they have large numbers of them. And the more research that we're doing on these, the more we are going to see the effects of papillomavirus. And we are looking into we know that certain compounds can increase the prevalence of infection or transformation, including, as we said before, immunosuppression or Brackenfern intoxication. It's likely that chronic ultraviolet light also may assist, because at least in certain species, a lot of these papillomaviruses in poorly haired or lightly pigmented areas, like the genital areas of mares, have a higher rate of malignant transformation. A lot more to be said and done when it comes to papillomavirus in animal species and man. Now, another virus which results in proliferative lesions that we're all familiar with is poxvirus. Let's talk about some basic ground rules for poxviruses as well. They tend to cause a combination of proliferative and necrotic lesions. That's number one. You never really have to think about a morphologic diagnosis for a poxviral or a parapox viral lesion, a very closely related virus family, because they're always multifocal coalescing, proliferative, and necrotizing dermatitis. And they also affect other organs as well. We'll look at that in just a minute. But everybody's got a bunch of pictures of poxviruses. They're photogenic. You can see them. You go to a zoo or something, you'll probably find a couple of animals in there that have pox lesions. In birds, and I just show this because everybody's got pictures of chickens with pox and all that. I'm just using a couple of raptors here. But the pox lesions in birds tend to turn up on the less feathered areas, so on the feet, on the face, around the beak or the bill or something like that. And that makes a lot of sense because most of these pox viruses, once they are inoculated by biting insects, and so it's very difficult for the insects to get in deep, darkly feathered or haired areas of animals. So we tend to see them on areas with more glabrous skin. Okay, so they're all proliferative and necrotizing. That's one. They're usually on poorly haired or feathered skin. That's two. The third thing, and one of the most important things to remember about pox viruses, as photogenic as they are on the skin, many of them cause similar lesions in epithelium within the body. So they're a systemic problem, and some are especially bad for that. Not so much the avian pox, but think about things like smallpox, which has killed millions and millions of people over the year because of lesions that it causes in epithelium. It causes the exact same proliferation and necrosis due to the cytopathic effects. When I say proliferative, it evolutionarily makes a whole lot of sense for a virus to initially, during early mRNA transcription, to release some type of chemical that causes cellular proliferation. Because if you're a virus, you want a lot of cells to infect. So artificially, you want to make more, and that's what a lot of these viruses that cause these proliferative lesions will do. The first thing that they do is cause tremendous replication of the target cell, which they infect. And then only later in the course of disease will they exert cytopathic effect by creating new virus particles. So as you look at a traditional pox, the outside is always a ring of proliferative tissue, and the inside, which is the oldest part, is the area that's dying because in these cells they've been infected the longest. Now they're producing virus particles, and that results in lysis of the cell and death. So necrotizing and proliferative dermatitis. And as we saw before, the poorly feathered areas of the bird. Some of these in birds can be extremely proliferative. And then, as we said before, think about the ones that have severe disease associated with smallpox. Camel pox is a bad one. Sheep pox and goat pox are bad ones. Some not so bad, like avian pox or maybe some of the monkey poxes, but they do cause the same disease inside the animal as outside. It's just not so photogenic. Another reason that they can cause severe problems. In this great picture, Dr. Ginny Pierce at the Frederick Animal Health Diagnostic Lab, especially in poultry and turkeys, you can get these severe infections which cover the eyes, and of course then this animal is unable to find food. A pox is a pox is a pox, and these are all proliferative. Here's some nice ones right here. Proliferative on the outside, necrotizing on the inside. So we have a multifocal coalescing, proliferative and necrotizing vulvovaginitis in this sheep. Sheep pox is a severe issue for sheep. They tend to have these large plaques in the lungs and on the kidneys especially. The incubation period is about 48 days, a little bit longer for goat pox. The condition is similar in two diseases, but it's less severe in goats. One of the things that you'll see in the sheep is evidence of systemic infection with mucopurulent discharge, crusting in the nostrils, and you just see these lesions, these proliferative lesions in the lung and in the kidneys and anywhere where there's epithelium. Here's more sheep pox. Here, great pictures from an outbreak a couple years ago by Dr. Bikram Singh Vashist. And you will often have some significant mortality in affected sheep, not so much in goats. Now, another problem that we have with caprapox is it has the ability to jump species. And when it jumps into cattle, especially young cattle, it causes this tremendous proliferation of nodules, necrotic in the center. And this is called lumpy skin disease. Lumpy skin disease. And it's transmitted by biting flies, and they get these rather large proliferating areas, which ultimately will separate from the underlying. They contract and they separate from the underlying tissue, resulting in this condition known as a sit fast. That is where this proliferation has become necrotic, and it peels off, and obviously it's going to ruin the skin. Obviously, these severely affected animals are going to have trouble eating and nursing and putting on weight. It's an emerging disease in Africa. It's been well known for a long time. It continues to increase in importance. And, these animals just aren't going to do well. Also, these sit fasts may be infected by flies and maggots, and it can be a real problem. And remember, people with sheep and goats, they tend to move them around a lot, and so it causes an increased exposure to cattle for passing on this and other diseases. The mobility of sheep and goats has been a chronic problem for veterinarians over the years. We've been able to totally eliminate the disease of rinderpest, but the disease of Pastille du Petit Ruminants, which is almost the exact same disease, it's a morbillivirus virus that causes ulcerations in the respiratory and digestive tracts, is doing as well as ever, because it is just so tough to pin down the people with sheep and goats, because they move them around on such a regular basis. Now we look at these sit fasts. I'm going to mention another herpes virus. And I don't want to upset anybody, but unfortunately, most of the herpes virus we talked about in the last lecture that caused necrotizing lesions. But here's one that looks almost exactly like lumpy skin disease. That's the Parapox. And this goes by the name of Pseudo lumpy skin disease. And this is bovine herpes virus type 2, the same virus that causes ulcerative bovine mammalitis. So it causes ulcers on the teats, will cause these lumps underneath the skin, usually seen in the along the head and neck and back of the animal, but you can see them all over. And you can imagine how difficult this would be able to tell from the lumpy skin disease caused by the pox lesion. So this is pseudo lumpy skin bovine herpes virus type 2. Just a couple of one more pox lesion. This is camel pox. This is another bad actor. About 25% of the young camels that are affected are going to die of this disease. So don't think about the outside of the animal. Consider the inside. And that's why some of these diseases are just terrible for the animals and for the people who depend on them for their livelihood. Okay, I mentioned Parapox virus. And this is a very common disease and well-known disease of sheep and goats, which is caused by a Parapox virus. And the name of the disease is contagious eczema. Some people call it contagious pustular dermatitis, but most people know it by contagious eczema. This is a zoonotic disease, can be transmitted to people, in which it's called ORF. But this is a Parapox virus, and for all intents and purposes, the Parapox viruses cause the same sort of disease as the pox viruses. Multifocal coalescing proliferative and necrotizing dermatitis, or these are traditional pox, P-O-C-K-S. Each individual mass is a pox. And a contagious eczema is very common. It causes morbidity, but not a lot of mortality. The other thing that this Parapox will do is that it has the ability to infect the oral mucosa and the stratified squamous mucosa all the way down the esophagus and into the forestomachs. It does not affect the abomasum because that is glandular, but anything that has stratified squamous, so your rumen, reticulum, and omasum can have lesions associated with the parapox that causes contagious eczema. I had an argument in the middle of a lecture in Iraq a number of years ago with somebody veterinarian who'd been handling sheep for years, and he said that you could not get contagious eczema from a sheep. And these are pictures of people who got ORF, or contagious eczema, from sheep. Obviously, these are areas that probably it is traumatically inoculated, and people will develop these very large and painful, initially blisters and blood blisters, which will turn into ulcers, and they will heal, but for that it's quite painful, and it's not life-threatening. It's not life-threatening zoonosis, but you certainly can pick up contagious eczema. There are a number of other diseases that are caused by poxvirus. The Lymph virus, which causes Shopefibroma, Myxomatosis, which we'll look at in a minute, because they are proliferative diseases too, will cause proliferative viral fibropapillomas, heavy on the fibro, low on the papillo. So there's a lot of fibrous proliferation. And here is a red squirrel that is infected by the Papilloma virus. So that's one virus, 3 diseases, 2 in rabbits and 1 in squirrels. People call these Squirrel Fibromas because there's just not a whole lot of epithelial proliferation. Here is another one, and here's a picture just to remind us it's not what's on the outside of the animal, it's what's on the inside of the animal that counts. And this was a case of Squirrel Fibroma, which shows a very similar proliferation of the epithelium and fibroblasts within the lungs. And that's what we see in animals and people with various types of pox. So you have to be real careful and not just look. Don't judge a book by its cover, because all these animals with these lesions have at least a few of these internal areas of epithelial or fibroblastic proliferation within them. Just another picture of this is a bighorn sheep, so it can be transmitted to wild animals as well. Here's a great picture in the gingiva and proliferation on the lips as well. The gingiva is a great place to look for lesions associated with a viral infection in ruminants, because there's a lot of friction there. Animals are chewing, and so you get a lot of inoculation around the base of the teeth, and this is just a proliferative lesion. Parapox is sort of endemic in some populations of bighorn sheep and mountain goats, and it can spread to other wild hoof stock as well, including white-tailed deer and moose and elk in these areas. So it can be a real problem. Monkeypox. Okay, monkeypox comes in a couple different flavors, and this is the one. There's an African gray monkey. This is the one where true monkeypox is used as a substitute for smallpox by organizations like the CDC and the Department of Defense, who maintain vaccines and develop vaccines and protocols to protect us against smallpox. Although smallpox is considered to be eradicated, you want to make sure that you're vigilant against that. Look at this beautiful pock, proliferative and necrotizing dermatitis. As we said before, monkeypox comes in a couple flavors. The true monkeypox, there was a big outbreak in 2003 in the United States, which sort of raised our consciousness of it again. It is endemic in certain parts of Africa, and it will get into wild rodents who can be a host without ever breaking with the disease. And the disease outbreak affected 70 American citizens in 2003, and they were infected from caring for prairie dogs. And the prairie dogs were mixed with a number of African species of rodent, including rope squirrels and giant Gambian rats, during importation. And they were able to successfully pass the monkeypox asymptomatically to the prairie dogs. And then people bought the prairie dogs, and 70 people, including pet owners, the people working in the pet stores, and veterinarians, were infected with monkeypox. And it causes a rather large sore, a pock, and the news for a short while was flooded with some of these wonderful, beautiful little girls holding up their fingers and having this big, ugly pock mark on it, which they had got. Usually in monkeys with this, it's usually face, hands, and feet. But this particular virus can also be aerosolized. And of course, we always worry about somebody deciding to weaponize something like that. So there have been some excellent articles published on aerosol infection of monkeys, and you can have lesions throughout the body in the pharynx, the larynx, the lung, the spleen, and the lymph nodes. And that is pretty much how, if smallpox ever came back, how it would spread and how it spread historically. So this is the traditional monkeypox, pretty fast, 3 to 5 day incubation period. Now there is another type of pox, or several other, but there is another form of pox in which the pox are much larger. You see these large proliferative, just a little bit of necrosis here. And here we have a large one on the hand. And you know, monkeypox and this particular pox, which initially was called benign epidermal monkeypox, which is a terrible name. It was changed to Ortecapox, O-R-T-E-C-A, because there was a simultaneous outbreak in the Oregon, Texas, and California primate research centers. So they got together and they said, let's call it Ortecapox. Some people don't like that, and they refer to it as Tanapox. But it is a zoonotic disease. So that's why we have this person here not wearing any gloves. I would imagine if I was looking at this particular macaque, I would want to put on a pair of gloves. But these are larger, more slowly developing lesions than in the true monkeypox, and they have really large granular eosinophilic inclusions within the cytoplasm of the proliferating epithelium. There is a third, rather historical form of pox in monkeys. Haven't heard about this one in a long time, but this one causes, it is subcutaneous. It is known as Yabba Pox, Y-A-B-A, and the cells that proliferate are histiocytes, and it causes these sheets of histiocytes with inclusions, and over time, like many of these pox lesions, the lesions are infiltrated with CD4 and CD8 positive T lymphocytes and will regress over time. I've not heard of Yabba Pox in a number of years, but it is still out there. Now, another very important disease of mice, not totally historical, because there are still outbreaks of this, is a disease known as mouse pox. It's caused by the ectromeliovirus, and it's another really bad actor. The lesions on the outside are generally more gangrene, dry gangrene, and loss of the legs and the tail, rather than true pox. You can see them, but it quickly progresses to gangrenous pododermatitis. But this is also a bad actor because you have large areas of necrosis in the liver and spleen as well. You know, just reminding us that pox viral infections are systemic disease. Another picture of this. One of your rule-outs for something like this is going to be the cornification defect of ringtail, but you're also going to see systemically ill ruffled animals with extremities that are just turning black and coming off. This is one of my favorite pictures. This is from Dr. Dean Percy. I called this "Waiting on My Prostheses." Someone really must have loved this mouse to do the amputations and to heal it. But a classic picture, the tip of tail looks like it's gone too, of the residuum of ectromelia virus infection. And if you were to autopsy this animal, you probably see stellate scars representing necrosis in the spleen. Mouse pox will come into a facility through contaminated products. I had a resident who graduated from his residency 1 week, and the next week he was sent to a research facility, and at the end of that week, and it's always on a Friday afternoon, I got a call and said, I got these really weird lesions, and these mice's feet are turning black. And it turned out on his first week on the job, after finishing his residency, he was smack in the middle of a mouse pox or an ectromelia outbreak. And of course, all you can do at that point is you have to depopulate everything. So it is still out there. We don't see it very much, but you can still think about that. Pox causes all sorts of great diseases. And here's another proliferative disease that affects wild cottontail rabbits. You can inoculate laboratory rabbits with it, and they will get very sick and die, but it's traditionally considered a disease of wild Oryctolagus rabbits in the Australia, US, and Europe. And you have these explosive outbreaks of a disease known as Myxomatosis. And this is that same virus that caused Squirrel Fibromas and causes another localized tumor called a Shopefibroma. And it's a lepropox virus, and very closely related to vaccinia virus. And what it does, it gets the name because there is tremendous edema, initially starting around the bite of an insect. It's usually transmitted by fleas and ticks. And when they bite, you get this sort of reddening and edema, and then it very quickly spreads throughout the animal's body in 6 to 8 days. The animals have severe full-blown disease. It's also extremely immunosuppressive, and you get this tremendous edema under the skin and a proliferation of atypical fibroblasts known as myxoma cells. And you will see the pox viral inclusions within the cytoplasm of these myxoma cells. Look at this. This isn't a lop-eared rabbit. This is a normal laboratory rabbit. His ears should be sticking up, and there is so much edema that it's just pulling them down. And these animals die generally of immunosuppression. You see severe lymphoid depletion throughout the animals. You can see, because in addition to the proliferation here, you have proliferation of type 2 pneumocytes in the lungs. So you have these large areas which are essentially unable to exchange oxygen. So it's like so many pox viral diseases. This one has a high mortality rate as a result of multi-organ dysfunction, and then the secondary bacterial infections resulting from immunosuppression. So pox viral diseases are not just nice photogenic diseases. As I mentioned before, there is another form of lepropox in wild rabbits, and this is known as the Shopefibroma. It is also it's a fibroblastic tumor in which you will see proliferation of sheets of fibroblasts, and the overlying epidermis is also very proliferative. And all of the cells, both fibroblastic and epithelial, will have inclusions. Usually in adult immunocompetent animals, it's one or maybe multiple hard lesions which will regress over time. You occasionally, in young animals, will see visceral metastasis, but that's pretty rare. So this will go away. Another There are so many pox viral lesions out there in the more exotic species as well. This is one. This is a Parapox infection that has come around in the last decade, and this is laying waste to the red squirrels in England. It came over, this parapox came over in gray squirrels, which were imported from the U.S., probably for hunting or something like that. And this virus, you never want to do that. You just don't want to introduce foreign species, because things like this will happen. And they brought this parapox virus, which causes no disease in gray squirrels, and then the native red squirrels, these beautiful squirrels, are now being disfigured, and they die of multi-systemic disease common to so many pox viral lesions. And just feel so bad for these animals, and you wonder what people are thinking when they bring in non-native species for sport. So red squirrel parapox virus is a real problem. Everybody has it. A great picture from Dr. Ang Chi Bing, which was published in the Journal of Veterinary Diagnostic Investigations, of pox in white-tailed deer, and they had oral lesions as well, and this perivascular dermatitis with GI lesions in the rumen, and all of which had had beautiful inclusions. So deer pox, giraffe pox. Okay. Oh, giraffes also can get sarcoid lesions from bovine papillomavirus type 1. And I guess you can imagine in some parts of Africa where people are trying to raise cattle, and you have wildlife too. So they have papillomavirus, and they also have the pox virus. And then one more. This is seal pox, which affects pinnipeds, which include seals and sea lions. And you often see outbreaks of seal pox, and it's a zoonotic disease. So people that are working at these rescues or whatever, if they come in contact with these animals with the acute lesions, can actually get proliferative lesions themselves. So seal pox. Okay, let's look at a couple more viruses that cause proliferative type of lesions in affected species. Here's one that affects a wide range of species, and the proliferation is often restricted to the pads, the chin, the nasal cavity. You get sort of this scurfy proliferation. This is a skunk in this great picture by Dr. Rob Ossabaugh from the University of Florida. I always thought that this skunk is surrendering, but you can see the tremendous keratinization or hyperkeratosis of these pads. And this is what is seen in canids and viverrids and mustelids and a number of species with canine morbillivirus or canine distemper virus infection. One of the early signs is this hyperkeratosis, which has been classically called hard pad disease. These animals will go on to die of immunosuppression, bronchopneumonia, and diarrhea. But one of the earliest signs that you can see, and I'm very familiar with this in pet ferrets, because unfortunately I've had to deal with a number of outbreaks in large facilities, and one of the earliest signs that you can see, even before you see mortality, is hyperkeratosis of the foot pads. Here is a weasel with you can see the hyperkeratosis. It's usually confined on the nasal planum. We don't see the pads here, but along the lips, the nose, and here on the ear. So hyperkeratosis associated with morbillivirus infection. And morbillivirus infection is well known for making rashes. Here is a young cyno monkey with a rash resulting from infection with another morbillivirus, a measles virus. As I say many times, the diseases of non-human primates are diseases of captivities. There's no measles in wild populations of macaques. It is always brought in by the human caretakers. And we thought this was a historical disease, but now that it appears to be in vogue not to vaccinate for measles, I think we're going to see a recrudescence of the symptomatology of measles. And unfortunately, hopefully we're not going to see this. Non-human primates are often vaccinated, usually vaccinated against measles in large, well cared for facilities, but pet non-human primates generally aren't. So if you are a exotic animal practitioner, I would put this one back on your radar. Measles, and the virus is very highly contagious. It's spread by aerosol, and you get these rash, which usually starts on the face, the ventral abdomen, and the inner thighs, which is great because this picture shows us the back of the animals. Animals usually have a fever, a conjunctivitis, leukopenia. There's a very characteristic lesion in the oral cavity called a Koplik spot, a little focal area of necrosis which precede the skin rash, which is great if you can find them, but only about 30 to 40% of the cases have them. So characteristic if you can see them, an early warning sign, but in a sick animal, but it's not going to be there most of the time. Most colony maintained animals usually are 100% seroconverted to measles. In a lot of these viruses, infections are often subclinical, and you may have one or two animals. But so measles, and one of the things that you can see on biopsies, this is actually from a lymph node, but like all morbilliviruses, you get this fantastic multinucleated giant cell. And I love the name. These in human medicine are called Warthin-Finkeldy cells. Warthin-Finkeldy cells. And you can see them in lymph nodes, you can see them in the skin, you can see them in those Koplik spots. I'm not good with rashes. A number of viruses will cause rashes, and we've looked at measles, and we've looked at varicella, and this is another one. It's a very old picture from Dr. Gary Baskin, who in the early 1980s, in every subsequent issue of veterinary pathology for close to 2 years, he would review the pathology of a new disease at the time, which was infection with simian lentivirus, known as simian immunodeficiency virus. And one of the things that you will see is a maculopapular rash, which will contain giant cells, a little bit like those measles, giant cell dermatitis, giant cell enteritis, encephalitis. These are all, and pneumonia are classic signs of SIV in monkeys, in addition to all of the crazy wild infectious diseases that you'll see in animals with severely depressed cell-mediated immunity. But to me, a rash is a rash is a rash, and biopsies are really good for helping to sort those out, and PCR. Another skin disease that has become very prevalent in the last 20 years is caused by porcine circovirus. It is a two-pronged disease. The name of the condition is porcine dermatitis and nephritis syndrome. So these animals will have vasculitis both in the skin as well as in the kidneys. It usually affects young animals from 8 to 18 weeks of age. It's usually low prevalence in affected herds, and so many herds are affected with porcine circovirus and don't show any outward disease. Luckily, it's a low prevalence. So it's low mobility but high mortality. And you get these sort of reddish-purple blotches, which represent thrombosed vessels. In the center of each of these is a thrombosed vessel. Another disease of the skin, which we want to look at when we talk about bacterial diseases, which is very similar, is erysipelas, or Erysipelas thrixerusiopathi infection in pigs. Those lesions are traditionally throughout the entire animal's body and are more rhomboid in shape, although you cannot always believe in that. The lesions, vasculitis associated with porcine circovirus, tends to start over the back end of the animal and move forward, starting over the hams and moving forward. It's a necrotizing vasculitis, essentially, with thrombosis, and skin and kidney are the most commonly affected. And eventually these are going to coalesce beautiful lesions. And you can see these are areas of cutaneous infarction. And in the center of each of these is going to be a thrombosed vessel as a result of infiltration and necrosis of the wall of that vessel. Porcine dermatitis and nephropathy syndrome, one of the many different manifestations of porcine circovirus type 2 infection. People have also associated this with a couple of other viruses. I don't want to blame it all on PCV2, but porcine arterivirus, which causes PRRS, and even strep suis has been incriminated in a number of these cases of PD and S. Just a couple more viruses we don't want to forget. Here's one we tend not to think about a lot in the skin, but it causes some very characteristic lesions. And this is avian influenza, or highly virulent avian influenza. And this is the classic lesions of shank hemorrhage. One of the many cell types that the avian influenza virus is able to infect is endothelium. So you are going to get hemorrhages throughout the body. It's one of the classic signs of a triad of diseases, which includes visceral Newcastle's and pastoral melanosis. So hemorrhage is a big thing, but this hemorrhage on the shanks is very characteristic for HP, highly pathogenic avian influenza. Here's another circovirus that is well known to cause ultimately fatal disease in psittacine birds, and all psittacines appear to be susceptible. And this is psittacine beak and feather disease, which is fairly descriptive. And the virus infects the follicle of the feathers, resulting in necrosis and either loss or clubbing of the feathers. And in these follicles, you can see these beautiful botryoid or grape-like basophilic inclusions. It also causes problems with the beak. The beak becomes brittle, can ultimately break. So psittacine beak and feather disease, another circovirus which affects the skin. And we are getting very close to being done. You know we're getting closest when I start doing fish diseases, and I don't do a lot of fish diseases. This is an absolutely fantastic disease, and one of the few that I think I really understand. And this is a disease which is known as Lymph Assisters disease. The virus is a member of the iridovirus family, and it causes tremendous proliferation, almost macroscopic, but proliferation of the fibroblasts. They get huge, absolutely huge, often seen on the fins and on the skin. And these cells, you look at them under the microscope, and you get 4 or 5 in a field, and they have these beautiful basophilic cytoplasmic inclusions. And it's this proliferation, and you can see it in a wide variety of fish, especially pet and ornamental fish, and it causes these sort of fleshy looking growths on the appendages. So that is Lymph Assisters, and it's a fibroblastic proliferation. Okay, here's a carp. If you've never seen a carp before, it could be a goldfish, and it looks like candle wax has been sort of dripped over this animal. And that's the best way I can describe these lesions, which are known as benign papillomas or papillomatosis. And just to make everything even more confusing, okay, people call cutaneous papilloma. The disease is known as Carp pox and is caused by cyprinid herpes virus 1. So it doesn't make any sense. Someone should have really straightened this one out. But cyprinid herpes virus type 1. There are several different types of cyprinid herpes viruses. Type 2 causes renal necrosis in goldfish and koi. This one just causes this benign epithelial proliferation. Now, it has been associated with cutaneous squamous cell carcinoma. That make a whole lot of sense because herpes viruses and squamous cell carcinomas don't really go together. But so this is, just remember, looks like someone dripped candle wax on the fish. That is cyprinid herpes virus type 1. there are a number of herpes viruses that cause sort of proliferative lesions. The rhinovirus, which causes retroperitoneal fibromatosis, causes a proliferative lesion. This is a herpes viral lesion that is seen in green turtles, and it causes these large proliferative growths. The name of this is green turtle papilloma associated herpes virus. I hate when people call things that's herpes virus incite papillomas. You know, just because something's papilloma, that means it's sort of a papillary growth, it's exophytic, doesn't necessarily say that it's caused by papillomavirus, but sure would make everything interesting. So this is herpes viral associated disease, and it depends where it affects the animal. Obviously this one's affected by the eye, and if you have ones that affect the animal around the face or around the mouth and prevent them from eating, obviously it will be life-threatening. Having one on the back of your neck where it might be uncomfortable, it is not going to be especially life-threatening. But this is fibropapilloma associated green turtle herpes virus. Oh, this is just another fish disease. And this is a dermal sarcoma. And this is a walleye. And these have been associated with retroviruses that encode D-type cyclin homologs, which allow the cells to escape from the cycle. And so these are retroviral induced neoplasms in walleyes. Now we're going to end with a couple of big diseases. I only need to show you one picture of this. And this is a chicken who has obviously been plucked, and you can see that all of the feather follicles are bulging from the surface because they all contain neoplastic lymphocytes. This is follicular lymphoma, and it is a herpes virus which causes lymphoma. It causes lymphoma in multiple organs. Follicles only one. The name of the disease is Marek's disease. This one's a little confusing because this is an alpha herpes virus. We tend to think of the gamma herpes viruses as the ones that cause lymphoproliferation. This is an alpha herpes virus. It sits by itself in the alpha herpes virus genus Mardivirus. I guess Mardi for Marek's disease virus. So it's an alpha herpes virus. You could call this a lymphoblastic and lymphocytic perifolliculitis, but I've always just called it follicular lymphoma for sake of argument. And when you look at these, you have the follicles are jam-packed with lymphocytes. Often you will have other lesions in these birds, including infiltration of the viscera, perhaps infiltration of some peripheral nerves, especially the sciatic, or another odd place would be the iris. But it is a alpha herpes virus. This is avian herpes virus 2. Remember, one causes infectious laryngotracheitis and is a member of the ILTO virus family of the alpha herpes virus. It's ILTO for ILT, infectious laryngotracheitis virus. But this is Mardivirus, Marek's disease virus, a classic herpes viral associated proliferative lesion in the skin. And then the last one, I didn't know exactly where to put it, and I'm just going to put it in here. And this goes back 50 years when this agent was called a slow virus. But I'm throwing it in there just so I can. And this, of course, is scrapie. And I'm just going to put all the prions in, lump it in with this one slide. They don't really cause skin lesions, but because of the altered mentation, these animals often will rub the wool or the hair off various parts of their body. So I'm just putting it in there to show that if you see a sheep or an elk or some type of a mule deer, one of these animals that have spongiform encephalopathy or wasting disease, they will often have large areas of missing hair because of altered mentation, abnormal behavior, and they will rub against stuff and just rub it off. So, I feel bad putting the prions in with the viruses, but let's just do it, we'll say we didn't do it, and we are done with all the prion diseases as of right now. Hey, that brings us to the end of this lecture. We peaked out at about an hour. So thanks for hanging in there. I really appreciate it. We've covered all the viruses. Next time it's on to the bacterial diseases. And I was surprised I don't have quite as many bacterial skin diseases as I do the viral diseases. But remember, this is the selected gross pathology of the integumentary system. So you're not going to find every little disease in here, just the ones that I think are fun and interesting. Hey, thanks for spending time with me today. Have a great day, and I hope you all wonderful health and a wonderful day. Take care now.